Hey, welcome to Health Storm. I'm Vic Gatto, your host. Have a great show today. Marc Watkins is the Chief Medical Officer at Kroger. He is a doctor and he has a master's in public health. Great background. He's at the center of Kroger shifting to really change health in America. They have the reach and the power. I'm there twice a week buying food and getting medicine, and they're leveraging that to help our entire country get more healthy. Please watch. Great show with Marc Watkins, Chief Medical Officer at Kroger. Thanks. Okay, Marc, thanks for joining me. Excited to do this with you.
Thank you, Vic. It's good to see you again.
Yeah. We don't get to. You live right here in Nashville, but you don't get to spend enough time together.
Yeah, I'm on the road quite a bit,
right.
But anytime I get to see an old friend and an old classmate, it's always good.
Right.
Yeah.
So Marc and I, we were in the Fellows program together. I had Larry on here a couple weeks ago. So as you know, that was always entertaining.
Yeah, Larry is incredibly entertaining.
Yeah.
Just a whole. You're never quite sure what you're going to get.
Right.
But one of the things you're going to get is some good entertainment.
Yeah. Right.
Yeah.
So give the audience your background. Chief Medical Officer at Kroger. Mm-hmm. But where were you before? It's really interesting background through employer health and now retail.
Yeah, so I've been Chief Medical Officer now at Kroger for the past 2 years. Prior to that, I was Chief Medical Officer of the Little Clinic.
Right.
And so it's been a 5-year total.
Which is the clinic inside
exactly.
Kroger.
It's part of Kroger, wholly owned subsidiary of Kroger. And I've been with the organization about 5 years now. And so prior to this, I spent a little more than 6 years with Concentra Health Services in various physician executive roles. The last role I was in was one of the national medical directors, looking at how do we put some guardrails around trend and cost for employers, understanding their needs in this space. As you know, this is a very expensive and sometimes disconnected ecosystem that we're in, right? So sometimes because you spend more doesn't mean you get better quality.
Right.
And so we tried to help those organizations understand that. Had a stint prior to that. I spent almost 6 years active duty with the United States Marines. By training, I'm a board certified occupational and environmental medicine physician with a training in public health.
Yeah.
Had a stint with Nissan North America for a while as their interim medical director for North America. Really cut my teeth in learning about populations when I was in the military. And so bringing this forward to exert some pretty disciplined public health lens to what we do, as well as an understanding about how the intersections of populations, cost, and quality can begin to bend outcomes for all of us here in the States. And we'll talk about
there's a ton. There's a lot there.
Yeah.
I want you to tell me about the difference in working with a large employer, either at a place like Nissan or with Concentra, with multiple employers. How is that differentiated from being at a retail place like Kroger, helping consumers?
As we think about every employer has different needs. The populations they take care of are different. The working population can be different. The distribution or even the locations where they live and work are different. So understanding those regional variations are important, number one.
I mean, even within a city, there's differences in
we
sub parts of the city.
We know that there's a difference in life expectancy in North Nashville and in Williamson County and Brentwood, and it's somewhat upwards of 10 to 15-year life difference. So understanding those nuances in the communities that we live in make a huge difference. Understanding that some of the things that are happening, no matter the size of the employer, are likely representative of the entire country. And a working population, specifically a working population, is the healthiest population we have on the planet. If you're healthy enough to go to work, you are healthier than most people in the United States. And that's pretty true. What becomes challenging in that population is to understand the differences in the needs. And that's where we try to do a good job at Kroger, is just understanding our own associates.
Yeah.
A little more than 500.
You employ a lot of people.
550,000 or more associates around the country. So that's a big population. And so we get to learn a lot about what that looks like.
And then you take people walk in the store or they walk in the little clinic with all kinds of needs.
Yeah, and you're right. So if you think about us in totality, it's close to 11 million people a day are in our stores or on our digital channels in some degree or fashion throughout the day. So it's a lot of traffic, Vic. And so I say this a lot.
That's 11 million a day.
A day, right? Yeah, that's a huge number. It's interesting, after being at it now for almost, I was looking at almost 20 years now in healthcare. In some
and you're only 23 years old.
That's
so
right.
You started early.
Yeah. That's why I like you. That's why I like you. Yeah, one of the things is that there's three places really that you get a great window into the world of your community. One is the grocery store. Mm-hmm. The second is the emergency department. Really, you see all comers, right? You'll see all comers at our store. And then third, it's the county jail, right? You have all comers to the county jail at some point, right? The rich, the poor.
Right. What's interesting about those three is the grocery store is the place where you're more on the front end. I mean, once you're in the ED or the jail, it's harder to take that back.
Yeah, the cat's out of the bag, right? Yeah, the horse is running down the pasture.
Yeah, and I was thinking as you were describing that, I was thinking, I see my primary care doc once a year, and I feel good about that.
Congratulations.
Yeah, I mean that's great. That's standard of care, right? Because I'm pretty healthy. But I'm at Kroger, and I shop at Kroger. I'm at Kroger twice a week.
Yeah,
because I'm getting food, and I have two sons that eat a lot, and so we can't keep the house stocked. But I'm in Kroger all the time, so just from a frequency point of view, I see my doc once in a while, but I'm at Kroger, and so the opportunity to affect change and affect behavior and get me making better choices, maybe a little bit at a time, is much more impactful when you see me all the time.
Well, first of all, thank you for your loyalty to Kroger. Thank you. We appreciate that. And what you're talking about there is just so true. That folks are in our locations. You're talking about over 100 times a year. You just mentioned
so I was saying twice a week, so that's about right. Yeah.
You may be in there a bit more if you're planning.
Well,
for
my
things
wife
at the house.
is there too. Yeah, right.
Yeah, so you have the whole family that's there pretty frequently. So again, thank you for your loyalty. But that also comes with tremendous, not only opportunity, but a sense of making sure we get this right. And we believe that the window and the first part of where we should think about the intersection of understanding how we can do a better job with healthcare is with food. And that, as the nation's oldest, largest traditional grocer, we have the license and almost the authority to say we know a lot about food.
Yeah.
From our manufacturing plants to the
I
volume
mean, how many private labels do you have?
We have several under the Simple Truth brand, our private label selection. We have a organic line that is, as you mentioned, Simple Truth.
Yep.
That's really committed to being at a price point where folks can afford it, right? And then also be free from additives and preservatives, and we're proud of what's not in it, right?
Yeah, right.
There's some good things.
Yeah.
We like that, the fact that if we thought about that as a standalone item for Kroger, we think that's about a $20 billion brand.
Yeah. Right.
Yeah. So
Wow.
Yeah.
Yeah. The scale that you think through, that Kroger thinks through, there's not a lot of platforms that are that kind of scale.
No. And especially when it comes to food, right? And we'll get into it. So what really makes us tick, and I'll kind of take a step back. We got into healthcare 40 plus years ago on the pharmacy side as a means to deliver convenience to our customers as kind of a one-stop.
Right.
If you kind of take that back to the genesis of Kroger and how we started with Barney Kroger in Cincinnati.
Yes, I don't know this story. Tell me the founding story.
So over 137 years ago.
So it's actually a guy, Barney Kroger,
out of Cincinnati, right? He put together money from his family, a small sum, and he really wanted to provide value.
What year is this?
Oh,
roughly.
Goodness. We can do the math, right? 137 years. You're smart at numbers. What is that?
So that's around 1900, before 1900.
Before that, right? Yeah. So, what was interesting is that he was one of the first in the retail space to offer baked goods and a deli and meat and a butcher under one roof, right? So think about convenience. You fast forward in 45 years ago with the pharmacy coming in, it was about convenience and really giving that convenience to the customer.
Yeah.
And then when Kroger was very intentional, and our chairman and president, CEO, Rodney McMullen, made the intentional decision to come into the clinic business, it was because of the voice of the consumer. He got together and had several town halls and opportunities to talk to loyal customers of the Kroger company. Mm-hmm. And what he heard all the time is that I'm strapped for time, and also I don't have access to health care. I can't get to my doctors. I can't get to my healthcare providers. And so at that point, an investment was made in the little clinics at the time, and then a wholly owned subsidiary by 2010. So fast forwarding 10 years, we've done a lot to try to, one, earn the trust of the consumer, right? Build a foundation that's based on quality and safety. We're Joint Commission accredited, and we're doing things that really should begin to move the mark on the clinic side.
Yeah.
Just like we're going to have this conversation about food as medicine.
Yeah. Right.
You'll.
And it's both ends, right?
It's both.
You take care of me on the clinic side, and then try to help me eat better and be in the clinic less often through my diet.
Absolutely right. And so we'll go through this today.
But one of the things I want to not lose track of is oldest and biggest grocer in the country, and it strikes me that food and the family meal is really an emotional, cultural experience, and that has to be taken care of seriously, right? And health is also really emotionally charged, and so you're in a unique position of being kind of at the center of all of these family meals. We have Christmas dinner, we have Easter dinner, we have Thanksgiving dinner. People have their traditional meals they have with a sporting event or at graduation, or and they're shopping at Kroger before that. And so it's emotionally charged and really part of what it means to be in this family or this culture. And it's similar, it's probably more foundational than the healthcare side.
I let me add a couple things. How incredibly privileged I am to be part of an organization that has those two things. What is more emotionally charged than food and healthcare?
Right.
And so sitting here even talking about it gives me chills, right? That is just, I find myself
making
incredibly
an impact
fortunate.
On the world. That's a huge swath that you can impact. Yeah,
and really being able to be here with our teams of incredibly talented dietitians, nutritionists, our pharmacists, our nurse practitioners, our physician assistants, and then that makes up about 22,000 associates under the Kroger Health umbrella.
Yeah.
And that's a huge number of associates that are really committed to helping people live healthier lives. And we believe that starts with the things that you were talking about. You mentioned that these dinners and associated with sporting events. I can't think of anything more emotionally and personally charged than food.
Yeah.
We eat with it. We celebrate. I mean, we of course we eat it, Doc, but we celebrate.
Yeah, we mourn with
it.
We
mourn with it. We cheer with it. Your first date is around food.
Right, at birth, at death,
that's
at
right.
Your first date.
Absolutely.
There's food involved in all of that.
And if you have certain meetings, that people are more concerned about what's going to be on the menu than they are about the meeting.
Right.
And that's how important it is. And it's very personal as well. Mm-hmm. And I'll unpack it just a little bit later. Yeah. But eating. And this is where we are trying to help people eat healthier, but change the way America eats. And so our CEO, Rodney McMullen, says very publicly, how can we help America change the way they eat? Mm-hmm. Right? And that's through a couple of ways, right? Offering them, great selections, fresh food at good prices, right?
Yeah.
In a convenient location with friendly, caring associates.
And it's sort of you can still have so like my wife makes these cheesy potatoes that my boys really like, and they're always going to like
good.
that, right? But let's try to add in around the side of that, or change the ingredients slightly, so you can still have that experience, but let's do it in a way that sort of moves us a little more healthy too.
Yeah, and there's options, right? And so as we understand that we want you to enjoy food, right?
Yeah.
We really want you to have what we believe is, quite frankly, a love affair with food, right?
Mm-hmm.
That food does not create the things that we know that we're seeing in some of our healthcare data that are attributed to things like obesity and diabetes and high blood pressure. But how can we help people live healthier lives? How do we help them at the same time really enjoy food in a meaningful way that they want to do for themselves and their families? And you described the story from your wife and these cheesy potatoes. We learn to eat from our families, right?
Yeah.
So eating becomes a learned behavior. And who does, we probably think that mom has probably curated lots of meals and likely has influenced our behavior around food.
Yeah, for your whole life. I mean, for 80 years, 70, 80 years.
Oh, yeah, right. And then she likely learned that behavior from
her mom.
Her mom and her mom the same way. Right. So it becomes a cultural thing as well. So there's a very symbolic meaning to food and food preparation and how you share food, what you eat and what you don't eat. Mm-hmm. And so when I said we need to think about personalization of that journey for folks, I was just with someone at lunch today, and I said you have to be very considerate of types of foods that you introduce to communities that may not be aware of that food. She was telling a story about children at the YMCA day camp up in North Nashville, and they had a special healthy lunch, and she said these are all actually 8 and 10-year-olds, and about half of them had never had fresh broccoli.
Wow. Never had it at all.
Never had it. I was asking, what is this? It looked like a little treat, right?
And so it is. If you've never seen it, it's a little quirky.
Yeah. And so how do we make food cool and healthy? Yeah. And one of the things that we're doing in our stores, we've removed that get a free cookie, and now you see we're actually, when we talk about food as medicine in the produce section, we believe that's the window into healthcare for us. And that happens when you walk into most of our stores on the left-hand side. You'll see that we don't have that free cookie thing anymore.
Right.
You can get a piece of fruit. And so we want to engage our young folks in that. That's cool, right?
Yeah.
It's cool to have a piece of fruit. It's good for you. And it's also, more importantly, the cool kids are doing it.
Right.
And so that can be one of the things that we're doing to, we still have cookies for sale, right? We still have brownies. But we also have really delicious options in the produce section.
And then in your background, I just want to underline, you mentioned it, but you had a training in public health as well as your clinic work. And I think that experience in both sides of healthcare must change the way you view sort of your approach to medicine.
Well, absolutely. And we get very good as clinicians of understanding what populations that we're treating, that we can develop frameworks around. And you have groups of folks that African Americans, old, children, incarcerated individuals, folks that are. And
we label and categorize them.
Well, and we do because we have some studies on them. One that's pretty striking that we don't have a lot of studies and we don't know a lot about are the LGTB community that we don't have a lot of data.
Just because it's too new? It's too new?
Yeah, we just don't have any. We're not tracking it very well. So we don't know a lot about their true epidemiologic risk factors as we do with, say, African Americans in this country and maybe other groups. And so docs have been pretty good, and nurse practitioners and physician assistants pretty good at understanding that of how to treat. Where it becomes a bit tricky is how do you apply that to the population in general, and that's very, very hard. So because it's not a one size fits all, and I'm going to go back to where I think we're doing some fascinating things is around personalizing the approach so that I connect with you on both a personal and an emotional level. I think once we do that, we create a longitudinal framework of trust. Once you do that, I think the next domino that falls is that we can encourage a different type of engagement because I meet you where you are. That's different than saying, I'm going to tell you what to do versus bringing you along.
Yeah, it's preaching versus teaching.
That's right.
Yeah.
That's right.
Yeah.
That's right. Yeah, so I can keep going on.
Yeah. Okay, so as you know, I asked you to come here to talk about the health storm.
Mm-hmm.
I see this storm on the horizon, pretty significant change to the $3+ trillion health system over the next 2, 3, 4, 5 years. And I think, it's basically 4 different trends that are popping up. So I want to talk through the trends and just get your feedback on them. So, because Kroger is really involved in all of these trends, I think. So the first is the rise of the consumer. So consumers are taking control of their own health care. Care is moving out of the hospital into the retail setting, the suburbs, and eventually the home. So that's the second trend. Mm-hmm. Technology and data science and population statistics and tracking how I'm behaving and meeting where I am and moving me forward, all that technical side of things. Mm-hmm. And then new entry into the traditional health systems. So it used to be you had payers and providers, and that was sort of it. And now you have Kroger doing a lot of healthcare, and there's lots of new entry into it. Mm-hmm. So those are the 4 trends that are, I think, coming together in the next couple of years to create this storm. And, of course, we need to take care of our population. The boomers are aging. They're going to need a lot of health care. And the systems will be there to take care of them, but they might look different than they looked 5 years, 10 years ago. And so talk to me about the trends. What do you see as those trends? Kroger's in the middle of many of those. Are they real? Am I too early? How do you see that?
No, I'm gonna preface it by a couple of points, right? So I think you're on to a storm, but I think you may be underestimating how big it is.
Okay.
So I think that when you describe the storm, I think we should give it like the Al Roker touch, that it has some degree of a category of a storm that we're concerned about.
Yeah. Okay.
I'm going to leave that to you, but let me paint a picture of what we're seeing.
What do you see? What do you see coming?
Yeah. So we, as I mentioned, have the privilege of in 2018 of having a little more than 185 million encounters, unique patient encounters at our locations.
Yeah.
Whether that's
So these aren't shoppers; they're in the clinic.
Yeah. These are either in the clinic or at our pharmacies getting medications filled. So they have interactions with pharmacists or our nurse practitioners or our physician assistants or dietitians. One of the things that really I believe is fueling this storm that you describe is that, and I think it's multifactorial, but one is in less than 10 years, we just had that Harvard study come out that we're going to have half of this country obese by 2030. I'm not talking about overweight, but obese.
Right. And obese, what's the definition of obese for the audience? Because you have to be pretty
35,
overweight.
A BMI of over 35.
Yeah, right.
You don't have to tell those folks that they are obese.
Yeah, right.
They've likely been told before, and they know.
Right.
One of the things that creates that opportunity is some of the things that we were talking before the cameras were rolling around, us not understanding the food and the impact of food we put in our body. I'm not suggesting that we all turn into a plant-free diet or adopting being a vegan tomorrow or paleo or going low carb or keto. You have to find what works for you.
Yeah.
And what we know today is that the standard American diet or SAD diet has not worked.
Yeah.
If we're on a collision course for that many people being obese by 2030, think about the effect it has on our economy. We're going to continue to add to the GDP with the healthcare costs. The 2 conditions, 3 I think about the most will be things like prediabetes, diabetes, and heart disease being the 3 big ones that
and those
are coming.
Are all highly correlated, maybe 90% correlated to overweight.
And I think in some populations it may be it may stretch that, but there's a tight degree of correlation.
Yeah.
I think where we also have to be concerned is that
so if half the population is obese, it follows that almost half, a lot of the population, 30-40% will have these chronic conditions.
At least.
Yeah.
I think it may be it may be more than that.
Yeah.
And I think that's going to be an impact to employers. It's going to impact them around productivity.
And
it's going to their
days working and how many sick days and
presenteeism, absenteeism, their medical cost trends, and how can they be competitive in a global environment, right? So we're thinking about that, and so second there, I think we have to address that. Half, actually, it's more than that, Vic. It's
because half are obese.
53%, right? 53% of Americans don't have $1,000 in their checking or savings account.
Yeah, that's
right.
Scary.
And so these are folks that are living paycheck to paycheck.
Yeah.
You add in
one health event.
I'm not going to even talk about a health event. Okay. Let's talk about a flat tire. They can't get to work. They miss days from work. They can't pay rent.
Yeah,
right.
And then it spirals down. Right? Then you can't get to work and get paid.
And then you're faced with making a decision on how I'm going to feed my family. Right. I'm going to make a choice. Do I then go to a location or fast food that I can get lots of calories for cheap?
Yeah.
Right. I don't have very many nickels to rub together.
Right.
And then when we're consuming healthcare, right? We talk about that a lot in our fellows class about the first premium dollar, right?
Right.
This is what's staggering to me, that about 70% of Americans will not make their deductible in 2020. So they'll pay 70% of their healthcare premiums through their deductible before they even meet their benefit.
Yeah.
So when we talk about folks
That's
being
how I'm in that category.
Cash strapped, right? So with a high deductible health plan, we talked about the rise of consumerism. I think there's, as you talk about that first thing, the consumers are at a little bit of a disadvantage, right? Because the buying power is going to be limited. Mm-hmm. They're cash strapped when you say the vast majority.
They don't have information.
They don't have information. There's more information and more transparency out there in the TV you're going to buy or the car you're going to buy than the health care you're going to consume. The next one is that I do agree that care is moving from the hospital to the neighborhood and to the home, and we're going to see that happen. We're seeing that with the boomers right now. They want to age in place. They want to stay at home. You see a rise in how they're accessing care. Every one of the boomers, not everyone, but dang near all of them have access to a cell phone, have a mobile phone. They've used it to connect with grandkids, so they're not technologically challenged as we might think they are. And they have some buying power, and they want convenience of healthcare coming to them. So we see an uptick in home services for them, and we'll continue to see that trend. There have been some things that have happened with the Medicare plans that have made it more conducive for the MA plans to have services to that population. Mm-hmm. But we'll see hospitals continue to struggle to capture patient engagement and contain patient drift away from their epicenter. So you'll see a trend of hospitals becoming less vertically integrated and getting out to where people live, shop, and work.
They need to do that, but they have significant fixed overhead in old buildings that I don't know what they're going to do with. They're almost monuments to the past, right? Right.
And it could almost be that these are museum pieces, right? We're going to see that happening locally here with many locations here in town, and we.
But Nashville's no different than half the cities in America. We have more hospital beds than we need because of these trends. It used to be that 95% of surgical and clinical services were done in the hospital or in the clinic right next to the hospital.
Correct.
And now that is diminishing. I mean, it's still 50%, but it's going to keep coming down over. And I'd much rather get treatment in the Kroger a mile from my house where I got to pick up bananas and other things anyway than go all the way downtown, park somewhere, hike over, get
That's
lost,
right.
and deal with that. So.
And as conditions become more complicated, we sit at a wonderful intersection, and I'm speaking about the little clinic, at a wonderful intersection that we can provide degrees of condition management. We can help with the episodic treatment of chronic conditions. You have a flare. We coordinate with primary care physicians and health systems pretty regularly. So we want to connect you upstream all the time. So with information sharing, this is a good segue to talk about technology innovation and some of the data science, right? So I think with the technology and the science that I'm seeing, and I had a little note to myself to make sure I mentioned this, was the avenue of precision medicine. How do we get more precise with not only our diagnostics, but with our treatment? How do we explore point-of-care genetic testing that reveals which medications that would be better for you before I prescribe them? And let me give you this. And guess how I find out that if you're allergic to penicillin, Vic? I write you a script. You fill it and then have an issue.
If I have a bad adverse reaction, that's how I now know I'm allergic.
And then what do? We put it in the chart and say you're allergic to penicillin, but you had to try it first.
Yeah.
What if we got to the point where we're able to do that simple swab, understand your risk profile for allergies, what works for you, specifically what degree of efficacy you're going to get from this dose of medication? Is it really going to work for you?
Yeah.
It doesn't
I think about
liver
like a
process
statin.
well. Yeah.
There's multiple options, and I don't know if the technology is available, but you could imagine personalized medicine where you can prescribe the right one for me that will have the most impact.
Correct, and that would be advantageous, right? That would be really,
for everyone.
Really, for everyone, and tremendous amounts of cost savings. And
where today you say, you're my doc, you say, well, try this one, and in 6 months we'll measure your levels and then see. And if it doesn't work, we'll try something else.
That's about right.
Yeah.
That's not very scientific,
right,
is it? Right. I mean, even you saying that in your own mind, I saw your face. He goes, "Well, that doesn't even sound right.
Right.
Why would I try that?"
I mean, we don't do that in any other phase of our world.
We would do some test and learn, but shouldn't we be at the point in 2020 that we shouldn't have to do as many test and learns to get the medication right?
Right.
So, and how do I started out by saying, we operate, and being chief medical officer, we operate only within the bounds of quality and safety, just like we do it in the food store, right? We can't harm you, we can't make you sick, we can't hurt you, and we lose trust. That just doesn't work. We have to stay within those boundaries, and so I'm a big advocate for things that help our clinicians make great decisions that are in the best interest of our not only for our patients, our future patients, but then for the rest of the Kroger associates, how they make great decisions to keep food safe, keep our stores safe, keep the products that we put on the shelf safe, so that you can have confidence going and putting that on your shelf at home.
Right.
And then the data science, right? I get fascinated by things like artificial intelligence, AI, blockchain. How do we crunch data a little bit better to have better insights?
Yeah, and Kroger has a lot of data that other health systems don't have.
Oh, yeah.
Like,
so
I scan the little thing on my keychain. You know everything I've bought in for, I don't know, a lot of years.
Absolutely. And so
I never eat the unhealtly stuff.
I know you
I
don't.
always give that away to my staff here.
That's right.
Younger,
That's right. Yeah. We again, that's been something we've done for a number of years, coming almost on 20 years of collecting loyalty data at the point of purchase to develop very, very strong consumer insights that we can then personalize your shopping experience at our locations, right?
And it's like all power, right? You can use it for good or evil. So, like, you can help me make better choices, or you can send me a coupon for something not that great that's going to drive a near-term profit.
Yeah, no, and I think
right?
I think
you
there's a combination of that, right?
So,
just be transparent. But I think there's an opportunity to engage with you on a personal level that we believe is a point of difference from other retailers in the space. So how do we know a little bit about Vic and his family? How do we personalize our offerings to you in a way that you are receptive to?
Well, particularly if I'm at the clinic and then I have my prescriptions there. Do you have the ability to pull that together and help me think through how my diet affects my medicine and my health?
So today we have a couple of ways, and I'll share the things that we're doing right now and the things that we have on our roadmap. The first is we have an OptUp app, and the OptUp app is a nutrition scoring system, and it's really based on your purchase behavior at our registers. So as you put in that loyalty number, we can track the foods that you have purchased. What's neat about that is that it's a very simple color-coded system, right? So red, we go red, yellow, green, kind of like a stoplight, right?
Okay.
Red is bad.
I can understand that.
That's right. That's right. 10% of your diet or less should be red.
Okay.
Yeah, we want 40% or less in the yellow and 50% or more in the
green
side, right?
Yeah.
And we'll give you an opportunity to have a score. Right now, we believe that a score, and this is at a household level, a household score of about 610 is healthy. We know that's related to rise in things like, we believe, a good correlate to things like diabetes and prediabetes, that you're eating a certain way, that
and
you're
600,
healthier.
what's the scale? Is it on a scale of 0 to 1,000?
Yeah, we do go up to 1,000 today.
Okay.
And so not to say that 1,000.
We don't want to be at 1,000.
900 and things like that.
Yeah.
We have some of our super fit foodie folks that are well over.
Oh, high is better.
High is better.
Okay. So the more green I have consistently over time, the higher my score goes.
And let me further kind of add some color to that. Within that OptUp app, we also have dietary tags. These dietary tags allow you to personalize what's important to you. So I remember in a conversation we had a couple of weeks ago, you said, "Hey, I've decided to kind of give up some meat."
Yeah.
So if I want to be vegetarian, I can put a tag on there, and as you scan labels, you can understand whether or not this meets your dietary personalized recommendation.
Okay.
Now let's think about that in terms of this health storm I'm talking about with diabetes and things like heart disease. What happens if you put a heart healthy tag on there? You put a diabetes tag, low sodium, Mediterranean diet. As you scan foods, it'll kind of tell you these are the ones that are, these are the ones that are in your range, things you should be getting. Yeah. It won't populate just based on Kroger Select brands, right? So this won't be private label centric.
Yeah, it's both. It's everything.
It's agnostic.
Yeah, right.
And but the one thing it's not is that it's not going to be influenced by the consumer product goods to say, hey, I want to get better. I want to get better airtime on your OptUp app.
Right.
So give me a better preference and a score that's untrue to the consumer.
Yeah. Yeah, you won't, as the chief medical officer, you won't allow that.
And I think our
what you'll say is make it healthier.
And that's
then it will
that's the chorus, right?
Yeah.
That's the chorus for all the CPGs today, that make this healthier, make it at a price point that makes sense so that you can have an informed, reliable source of information when you make a point of purchase behavior. So you know that, okay, this is better for me because I might get a few more points than this is in the yellow. I may not be able to go all the way to green, but I can find something that has less sodium, maybe less fat, right? Maybe the caloric density is a little bit better. And I talked about, as CMO, really making sure that the teams are grounded in the best nutritional evidence that's out there so they can help our folks make good decisions as they run the analytics.
Yeah.
And then new entry into health that's from non-traditional players, right? We're seeing a tremendous amount of interest, dollars and investments coming from venture, from Silicon Valley, from folks trying to do some things very differently in the space. One of the old things that's new again, right, is condition management.
Yeah.
Right. I mean, we've been doing that for 30 years. You can take any condition you want, and we've had some kind of program almost around it. And you'll see companies now that they have programs that are leveraging technology in a new way to disrupt our traditional way of treating conditions like diabetes. So they have your diabetes educator on an app. They're nudging you.
Yeah.
They're giving you opportunities to log your food. They're actually
and those tools don't work for everybody, but
Nope.
they work for some people.
Yes.
And they're helpful, and there's lots of choices, and so finding the right one for me is important. But they make a difference. They can help you,
and they can, right, in the right hands.
Yeah.
I think those new entrants are the most, in my mind, the most non-traditional players, because they are bringing technology and data analytics along for the ride a little bit different. And I was on the phone with one group just recently. He said, "Well, no, there are no scientists here. These are all data people.
Yeah.
There's no doctors. There's no pharmacists. There's no nurse practitioners. There are no certified diabetes educators. But we have health coaches.
Right.
And I think where we're seeing the rise in non-traditional trusted sources of information are very different today than it was 30 years ago. 30 years ago, we had a lot of the information exclusively coming from doctors, and doctors were mainly highly trusted.
Yeah, the man in the white coat told me what to do, and that's shifting now. I mean, there's plenty of docs helping people, but there's lots of other folks. There's the associate in the produce section telling me, okay, I want to make this broccoli for my family. How can I make it taste good so that my boys will eat it?
Yeah,
and that's as much health coaching as someone in a clinic.
And it's how we source our information, right? And so there's usually folks in the community that are very well respected, and in every community that, whether it's your pastor, your preacher, your rabbi, your coach, it could be your soccer coach, it could be whomever that gives advice, and folks trust. And if you kind of make the corollary between that and kind of a community health worker, we're finding that the rise of the community health workers in certain populations are really making a difference. And we're doing something at Kroger, which I think is pretty amazing, is around our food nutrition program. We recognize that it's going to be impossible to scale registered dietitians around our enterprise with almost 2,700 locations.
Yeah, just because the number of locations is a challenge.
Yeah, so how do we augment that with the nutrition techs, a tele-nutrition service that allows folks to access a reliable, trusted source of information by folks that have training from our RDs, from our Kroger Health team, that can help guide people to do just what you said, make that piece of broccoli taste better.
Yeah, right.
And then if it tastes better, and this is what a lot of us are saying, if it doesn't taste good, it's not going to be it's a showstopper.
Yeah, right.
You can't. It's got to taste good.
I go back to my French fries, and if you put a little bit of butter and salt on it, then I'll eat it every week, once a week, and that's kind of a middle ground, right? It's not perfect, but being perfect is not sustainable. Really, no one's perfect.
Yeah, and that's a good point. And I know that we're having a great conversation, but that's the reason why diets fail, right? And I know it's not on our script and our agenda to talk about today, but folks, these yo-yo dieters and folks that adopt the new fad and really try to change, lose weight, it's tough. The hardest thing you're going to do is be able to lose weight, then keep it off.
Right. I mean, it's fairly easy to do anything for 2 weeks, right? But the harder thing is to do it for the rest of your life or for a significant amount of time.
Yeah, so we know that we like behavior change to happen within 90 days. We think that's a good thing, that we're on the right track. If we can get out to a year, we know that we're onto something, and that's lifestyle change.
Yeah.
And you think about the next year after that, if that behavior is sustained for 2 years, the relapse is lower. It's much lower than at 90, 180, right?
When you start getting positive feedback around the new lifestyle.
That's right. And we're in that window right now, Vic, that everyone made their New Year's resolution. They've been in the gym for the last 3 months. Right. The month of March is going to be over. The folks that made no headway, they're going to quit this month if they haven't quit already, right?
Right.
And they'll just give it up and say, I'll wait till next year. They'll be frustrated. They'll be tired. They don't know why it didn't work for them. And I think everyone can benefit from understanding what works for them, that your journey, it can't be my journey.
Right.
It can't be something that you see on TV. And so we encourage folks to talk to your healthcare professional, right? Talk to your pharmacist, talk to your dietitian. And this is putting my public health hat on, right?
Yeah,
so,
right.
Obviously, I want you to get your flu shot from Kroger.
Yeah.
Right? But I want you to get a flu shot.
Yeah.
Right? That's good
right.
for the public health. What's good for the public health, I want you to talk to a healthcare professional. I'm biased. I would like you to do that with Kroger on one of our channels, whether it's in person or on our telehealth platform. But I do want you to go to your PCP. I want you to engage with a healthcare professional. I want you to have those conversations because they can be very, very powerful. That can get you on the right track, and that can help you personalize your journey because everyone's journey is different.
Right. Yeah, so I think you said earlier something that struck me as, I mean, you have, I can't remember the number, millions of 10, 11 million people coming in every day. Mm-hmm. They're at all different steps in the journey, right? And,
yes.
And you said Kroger wants to meet the customers where they are, right? If you are really trying to give up sweets, let us help you see some fruit options and sort of help you with that. If you're trying to give up red meat, so I gave up red meat, then you can help me sort of navigate that, and you may need to add in another part from the store to sort of help support that. You can meet people where they are. If you want to eat healthy one day a week, there's lots of tools like, okay, keep the same way you're feeding your family, but on Wednesdays, let's try to change it up and try something new. And it doesn't really matter where they are in their journey. Kroger has the tools and the products, frankly, to support them.
Correct. And I think I owe you a follow-up to the last line of questioning. You said, is there an ability for the clinics and the pharmacies
to integrate
information data? And that's on our roadmap. We are also developed a HIPAA secure vault where we're able to collect the point of purchase at the counter, understand how that with the customer's consent and the patient's consent, merge the data between the pharmacy data, the clinic data, so those in the future the clinicians will have an opportunity to have insight into your food score, insight into a risk modeling. So we'll lay into that a little bit of predictive behavior, predictive analysis, to know those are at risk. So there's a story our president the president of Kroger Health, Colleen Lindholtz, shares with us all the time, is that almost 20 years of data shows that they know when her mom started buying a 12-pack of Coke a week. They know when she went on her first oral diabetes medicine. They know when she went on her first dose of insulin. They also know when her toe was cut off. So from
they
peripheral
can see
neuropathy.
that entire spectrum.
So in that modeling of food purchasing, right, pharmacy behavior, then you overlay that with clinic and you overlay this with food score, you have a kind of a really powerful opportunity to provide insight to other members of the healthcare ecosystem that would benefit from that, right? So how do we partner more effectively in order to share that data as patients consent us to do so? And we look back at that last question about incremental changes in behavior. I think it has to be one step at a time.
Mm-hmm. Yeah.
I think we all heard that adage: you can't eat an elephant in one bite. Right.
Yeah.
I don't know who eats elephants, but I don't think I want to try an elephant. But I think you have to take steps that make sense for you. And I mentioned why diets fail is because they seem to be non-conducive to a sustainable lifestyle change. It feels that you're restricted. It feels like you can't live with this, and you tell everybody you're on a diet.
Yeah.
I don't know who I've talked to that's on a diet who's not miserable. If they're on a diet, they're miserable. they're not happy. You know,
they're like
Vic, I'm on a diet.
They're trying to survive through to the finish line.
That's right.
And then they're going to go out and go off all the stuff they just did.
I'm going to be off the reservation, right? I'm going to go back to what my set state is. And there's so many folks that are yo-yoing around their diets, right?
Yeah.
And where we want to land is that food should be fun, but also it can be healthy for you, and you can create a lifestyle that makes sense for you, not for Marc Watkins, but for Vic Gatto, and for Vic Gatto's friends and family and children, has to fit for them. Yeah.
So we do research and then try to find investments in Jumpstart around things. We've been really looking into food as medicine as a research area. And I don't want to miss the opportunity to dig into it more carefully with you. I see two big sections of that. So that we've been talking about behavior change and choosing more healthy food maybe changes the trajectory of my health, and over 1, 2, 5, 10 years could really make a difference in my health. There's another entire side, I think, which is food insecurity, or kind of the cost of food and getting the cost down. Because if nutritious food is not available or not certain, how are we going to get it to people? And Kroger has the reach and power to sort of think through both those issues, I think. But I want to get your perspective on that.
Yeah, I'm glad you mentioned that. We're very serious about our food as medicine program, and I just food as medicine as a concept has been around ever since Hippocrates first said it. Let food be thy medicine, and thy medicine be thy food. So understanding that you kind of are what you eat is not new to us.
Yeah, but I think sorry, I'm going to force you to digress. But in the post-World War II, the U.S. turned its means of production from military to a lot of food production, food and cars.
Yep.
And that moved us as a society from almost all made from scratch, home-cooked food to more convenient, less expensive, faster, but probably not as healthy, mostly processed food, frozen and processed foods. And so in the 50s and 60s and 70s, we sort of lost our way a little bit from Hippocrates, and it went to quick calories, called TV dinner, like in front of the TV, and you can entertain me so I don't have to talk to my family members, and I lose that connection. I'm watching TV, and there's a bunch of ads selling me more stuff. Is that fair? Is that unfair? Kroger, was in the middle of that.
Of course.
So maybe I need to be careful, or we need to be careful when we talk about it. But that was what society did, and Kroger was providing what society wanted. But now we need to shift at least back to a middle ground, or back to more healthy food.
Yeah, it's interesting that you describe the advancements of industry technology at the end of World War II, creating a new economy for the United States. Right? We had lots of gearing
up. And that's
up.
More my assertion than I've done a lot of research on it.
But there's a lot of fact, and I'm going to show you where it's actually happening today in the world that's similar to the effects that we've had over the last 5-6 decades.
You can see it in other developing countries.
Absolutely. And what we see is that as we become more industrialized, our needs for quicker, faster, better, cheaper drive the business economy. You're appealing to the masses. You're appealing to the segment that's buying and funding these things.
Yeah. And we need to get the workers' calories at some level.
Yeah, and I understand. So we actually create this food industrial complex that creates very shelf-stable products that may be very highly processed, and we introduced those, right? We've introduced those.
They'll be stable on the shelf for 10 years, but they're maybe not as healthy as right off the farm.
And I'll get right back to it. So I was at lunch today, and the group I was talking to grew up in a rural part of Kentucky, and she remembered that Mom, the only thing that she ever made that was really bad for us that we really loved was fried chicken. And I said, what you're talking about is the Southern diet was probably one of the first farm-to-table diets, right?
Yeah, right.
You think about it. We think
literally the farmer's right next door. Right. You're on the farm.
That's right. That's right. So you weren't running to the store to get your foods, right? So a lot of things were coming from the farm, or you didn't eat it.
Yeah.
Let's fast forward as we become more industrialized, right? You have this refining and processing of foods. We know the further away that foods are from being in its natural state, our body begins to try to break them down, and we don't break them down as effectively as foods that are in a natural state. And I think that's pretty well known, right?
Yeah, our digestion system is not tuned to digest that.
And another economies that we're seeing around the world, as China has become more industrialized, they've moved away from the farm-to-table diet. Their cities have grown. More folks are not living in rural areas. They are less farm-to-table, and they're seeing some of the same effects of obesity in that country. The same with India with obesity, and as they become more technologically savvy, right? They're exporting a lot of their technological powerhouses from things they do in developing and development around IT, healthcare, and they're seeing that effect as they become more industrialized and more, quite frankly, more wealthy.
Yeah.
And back to your point, we need to be mindful of these trends. Be mindful that folks are still going to want convenience, right? They still want access to foods that meet them at their price point. But one of the things that we want to do is just recognize that the cat's already out of the bag. Half this country is going to be obese by 2030.
Yeah.
45.
Even if we change today,
the collision course
right.
may not.
Yeah.
It's just like moving the world's biggest aircraft carrier. We're not going to be able to change this on a dime.
Right.
But understand that 45% of Americans are suffering with a chronic disease. It accounts for 7 out of 10 deaths in this country. We know we have a lot of work ahead of us, and so we know many of the conditions I'm going to talk about, like obesity, heart disease, can be positively impacted by food. And
so, I'd say they could be cured by food. No,
at least
you may
not
say that, but
at least positively impacted. There's other companies that are new entrants and players that are out there that are claiming that they can reverse diabetes.
Yeah.
They have some pretty powerful stories about the diabetes reversal techniques they use, but what they do and where it centers on is food.
Yeah.
They're doing a very low calorie diet. They're restricting processed and refined carbohydrates that get you down in almost ketosis.
Yeah.
And they're driving a lot of benefit for those patients.
Yeah.
But that's not for everybody.
You could do that with a small population, but across the country, Kroger could move the disease, these chronic diseases, and I think there's more than diabetes and heart disease.
Got to start somewhere, right?
But asthma, COPD, stroke, there's a list that will all be correlated with a more healthy diet. The way that I think about it, just as an easy kind of thumbnail, is everything on the outside of the store is reasonably good for you. And then when you go in the middle, it's not as good.
So my dietitians, that's not true, the dietitians that I'm lucky enough to be on their team.
That you work with. Or
that I work with. Remind me all the time that, because you mentioned that sometimes frozen foods are bad, but frozen vegetables can be an easy substitute if done right. They still have a good amount of nutritional value.
And that's the choice people should make for convenience. Like it's much better to quickly pull out a frozen vegetable than
no vegetables at all.
And go buy a fast food place and you get protein and starch and that's it.
Yes. Yeah. So the vegetable would be a better option.
Right.
And so with our Food as Medicine program, we believe it's around a dedicated, educated, and personalized approach so that we can enjoy food and live healthier lives and prevent disease before it happens. No, it's a mouthful, but what that really means is we have to drive it across our business, and I'm going to get into why I think it's important. So we have to have the products, right? Healthier SKUs, right? Products that folks can quickly identify.
You and your buyers are talking with all the CPG.
Yes, and we need services, right? So I've outlined some of our dietitian programs, our nutrition techs in our stores to help you navigate successfully for nutrition that meets you where you are. Partnerships. We know we can't do that alone. We have to find partners that we can really be linked at the hip, that share our vision of helping people live healthier lives and do it at a cost-effective, meaningful way that makes a difference. And then finally, make the right strategic investments in this, right? We're investing in our OptUp app, introducing better technology, creating an opportunity for you to be able to scan labels independent of our store. So any product that in the future,
wherever I am,
that you can see that, and then invest as a brand where that OptUp scoring system will be on a food product, so you can easily identify, is this healthy for me? And then resources, making sure that we're committed at the highest levels of our organization around deploying the right resources in order to get it done right. And I think what we'll see by our 2025 initiative is that we'll see 20% reduction in 5 of the most important areas of health. One would be we want to see 18 million less obese people.
We're going to do our part. This is a Kroger plan by 2025.
By 2025, how do we reduce this obesity epidemic? So I mentioned that it's not like...
And is Kroger big enough that you're going to try to move the country?
I think this is a bold initiative.
Yeah.
And we're not everywhere, but in the communities that we serve, I believe we can have an impact, right?
Yeah.
18 million people is nothing to sneeze at. That's about $29 billion in cost savings that we can pull out of the healthcare system. The next is diabetes. We really want to have about 20 million less people with diabetes. Right now, diabetes or prediabetes accounts for about $245 billion annually. We believe that if we have 20 million less people, that's about $44 billion that we save the healthcare systems.
I mean, that's incredible. So I started as a venture capitalist in 2001, so a long time ago. But when I started, we had 17 million diabetes people in the country. And so how many are there now?
Oh, it's it depends on the population, but we have close to 33 million, and the numbers are expected to rise.
Okay, so by 2025, Kroger's initiative is going to take 20 million people, and they're not diabetic anymore.
Yeah, and the thing that's scary...
Now, it's in combination with
clinicians
and medicine and diet.
But you think about it, the total is about 114 million when you add in about 90 million or 80 million or so pre-diabetic, right? So it's a pretty staggering number.
Yeah, but that's 20% of the total.
Yeah,
that's significant in 5 years or 6 years. Yeah,
I know it's a bold initiative.
Yeah,
and the next one is around food insecurity. We mentioned that we want to have 8 million people less food insecure, and that's doing our part around campaigns about zero hunger, zero waste. We have a strong initiative to continue to support food banks. Our store managers are really trying to eliminate waste and shrink in their store, and to make sure that, like our CEO says, that there's no one in this country that should go to bed hungry at night. This is our small part to doing it, but we believe we can make some impactful things moving forward. And the last 2 things I want to share is around cost and assortment. So the cost is always an issue, and we talk about folks who can't afford healthy food, and you hear that misnomer a lot, that to eat healthy, I got to be rich. I can't afford it. We're going to try to drive about $58 billion in savings back into healthy foods, leaning in on CPGs to say, get the price out of it.
Yeah.
Right? Get it out, and then we want to pass that on to the consumers. Then
finally, you have the reach and the buying power where they have to listen.
I think it's the right thing to do.
Yeah. Right.
Let's
and they're going to sell more product.
Let's think about it, right? We can argue the economic optics of this all day. When we talk about half of this country being obese in less than 10 years, that's not somebody else's problem right now.
Yeah. Well, and that's not a little rainstorm. I mean, that's we can't take care of those people. We can't afford it. They're going to really suffer. It's going to knock over the entire economy.
This could basically bankrupt us, right? And then finally, as we lean in on that conversation around cost, how do we lean in with the CPGs and create better assortments? We want about 15,000 healthier SKUs to be on our shelves. So we're going to add healthier products so that let's take the guesswork out of it. If you think about what we're talking about, using the OptUp score, using our OptUp branding so that it's easily
it all
identifiable.
Sort of fits together.
It's very identifiable that folks can see this in real time, Vic, and we want to simplify it, right? Because we know healthcare and all these things can be very confusing for folks. Let's make it easy, cool, right? Let's make it fun to eat healthy, that you're able to identify this very quickly, and let's do it at a price point that is inclusive of all of us.
Yeah. Incredible. I'm very supportive of this. That's a huge set of goals, and great that Kroger's sort of taking that charge on its own, because you're a for-profit, publicly traded company, and having the foresight to do that while also meeting all the Wall Street earnings and things is incredible. So
it has to be about doing the right thing, right?
Yeah.
And I think we can do well by doing good.
Yeah.
And we're just one of many that have to come to the table and have meaningful conversations about the storm that you unpackaged, right? You unpackaged a storm that I think is probably at least a category 4.
Yeah,
it may be higher.
Right.
I don't want to sound like an alarmist, but it is high, and we need to do some things around it. And I think we have.
I was talking to someone yesterday, and she said, "The storm's not here yet, but it's raining outside." It's like right here. Maybe it's not category 5 yet, but it's on the horizon and coming fast.
Yeah. This would be if this was a storm, like you made the analogy, the weather channels and the owl brokers.
Yeah, all saying
they'd be yelling from the mountaintop.
Right.
That we got to take cover, and we have to do our part, but we can't do it alone.
Right.
And that's why it's so important for us to continue this conversation about food as medicine, making sure that we have an opportunity to engage not only the CPGs, but health systems, payers, policymakers in a way that they understand and can partner effectively with us to not only change the way America eats, but let's help them live healthier lives.
Yeah. And so is there a place on the Kroger website or a place where people can go to learn about the app tied to their buying and these initiatives?
Well, absolutely. So KrogerHealth.com.
Okay.
It's a wonderful opportunity to learn a little bit more about our organization, our people.
Yeah.
I'm very proud, as I mentioned, and privileged to be part of that team. And we've done a good job of putting that information together. One of the things that we've curated on that site is we want to be informational and informative, right? We want to provide you real good information, but really, as you're looking for things that are meaningful for you, that you can find them, right? So good tips, tips that could help with nutrition, or when should I see a clinician? What should I talk to my pharmacist about? Right? Yeah, those are really, really good things that I think can help to change a little bit of that trajectory with a little bit of misinformation.
Yeah, right.
We want to be a trusted source of information, just like we're a trusted source to get your food, your milk, and your eggs. We're not going to make you sick.
Right.
Knock on wood, that's not our business, nor is our business to push misinformation. So a reliable, trusted source for us at KrogerHealth.com.
Great. Okay, thanks, Marc. So the last question I want to talk through is, you've been doing this for 18 years. You got your MD in the early 2000s,
yep.
somewhere around there,
that's
maybe
right, that's right.
17, 18 years. What do you wish you knew then that you believe today?
Wow, that's a big question, right? So it's almost 2 decades. I had a career that I was in prior to going to medical school after college. I think, number one, and this is more of a personal note, number one, I would have probably taken more solace in the fact that I need to try to learn something new every day. I at some point, I'm like, I got too much to do, right? I'm in medical school. I got to graduate.
I'm so busy, I can't focus.
Yeah, and I think that I wish I would have known more of that then. But what I'm seeing and what I didn't know that I know now is that we're in a cycle of the same trends that we've been talking about for a number of years in this country. And you've been around in your field for a long time. We hear the term social determinants of health.
Yeah.
That's nothing new. It's been around 3+ decades, right? We talk about care management or chronic disease management or care coordination, patient navigation.
Yeah.
These things begin to recycle. And it seems like we keep recycling things over and over. I think that we need to also re-engineer the way that we're training health professionals about food. I had about 7 hours, maybe a little bit more, through fellowship and public health training.
Across your whole medicine education.
Yeah, and I'm a board-certified physician.
Right,
and licensed
7 hours.
Yeah, licensed in almost 10 states, right?
Yeah.
I find that to be wildly deficient. And I'll share a story with you that I wish I would have known this differently a number of years ago. If you came into the office and you saw me, and I'd say, well, Vic, I need you to maybe lose some weight. I need you to diet and exercise.
Yeah.
Guess what I would do next? I'd say, I see you in 3 months, and I walk out the door. I go to the next patient. I leave you. I just dive bombed you.
Yeah, you just tell me to lose weight.
With no plan.
No plan, no tools, no education,
Nothing.
No anything, and then you move on
then
to
I
the
move
next
on.
7-minute
exactly.
interaction.
Right, yeah. and I left you.
And you actually, the doctor says it, not even expecting the patient is going to do anything.
That's right, because we don't know what to tell you.
Yeah, and you see the patients have failure continuously.
And then what do? I may have a conversation. I may, some doctors may chastise you.
Yeah.
They don't believe you. Then we write more scripts for you.
Right.
Next thing you know, you're on more and more medications. There's side effects. I would have known how to better manage that conversation and help new entrants into healthcare have a better understanding of food as medicine and how food and behavior have a intersection between a lot of the things that we do. And as I mentioned, that prediabetes, diabetes, high blood pressure are linked to obesity, and we have to understand that we can help folks. And if I would have known that, I would have done a better job of even self-managing for me.
Yeah, and maybe it is true that physicians have a responsibility to help folks because it's part of getting them healthy. But we haven't provided the docs with the education and the tools and the structure.
That's right, and I
think they
think
should refer you over to Kroger.
That's one, yeah. Right. And I think that we can't do it alone, but recognizing that maybe that as a multidisciplinary approach, that traditional medicine begins to leverage the pharmacist, begins to leverage nurse practitioners and physician assistants and the dietitians to help them, right? You said 7-minute visit. How much meaningful conversation can you have in 7 minutes when you see you once a year?
Right.
Now, if you're in our stores 2.5 times a week, you can have a meaningful conversation with our pharmacist, a nutrition tech, be on a telehealth platform and begin to change that trajectory. And don't put all of these onuses on physicians to try to fix.
Yeah, it needs to be a team approach.
It really does. Yeah. And to understand this is more about a collaboration than competition.
Yeah, right. Great. Okay, well, thanks, Marc. I really have enjoyed it. We need to do this again.
Yeah, absolutely. And please give me your regards to your family, and it's good to see you again.
Yeah. We'll have you over for the cheesy potatoes.
That's right.
Okay, appreciate it.
Thank you, my man.
Yeah.